My name's Dr. Patrick Nabongo. I work with the Uganda TB vaccine study. It is a study that is managed. It's a study that is managed by the IDI, the Makerere University Institute of Diseases Institute, right? Yeah. And this project is funded through IDI by ERAS, TB Vaccine Foundation from the United States, together with the EDCTP. Now, the project that I'm working with, that is managed by IDI, the Institute of Makerere, is implemented, is planned to be implemented in Iganga, Mayuge districts, which are in the eastern part, in the southeastern part of the country. Now, the place in which the site in which we are implementing this project also belongs to Makerere, but under the School of Public Health of Makerere University. Now, working with this study, I work as the field manager in charge of the field implementation processes in the site. At this point in time, what we are doing is that we are preparing the site, the area that is under the site, to develop capacity to be able to carry out TB trials in new TB vaccines in the future. So what we are doing basically is to develop that capacity for us to be able to do TB trials in the future. I've in the past worked with the National TB and Leprosy Program. It was basically managing the program, control implementation, and generally care. But this one is much into research, and for me it is quite an inspirational thing after many years of working in basically management kind of program. At this point, in the formative stages of the study, I've been excited that it's been quite an opportunity to be part of this training that I believe has equipped me with the tools that I think are going to be helpful in guiding me, that I think are going to support me, that I think I'm going to use, I'm going to apply in the implementation of the field activities of this study. So what I could do, everything has been good, and I think everything is going to be useful when we come to the implementation of the project, which is going to be very soon. But one of the things that has been of specific interest to me is the quality control planning. I believe this is going to be very useful to me because clinical trials, one of the central pillars in clinical trials is coming up with the quality data. When you come with that, it's really what underlies everything that you do, because generalizability, validation of the results that you get are all based on the quality of data. So one of the things that we are doing at this point in time is trying to develop a quality assurance, quality control management system. We are trying to put it in place. Now, from my professional background, the medical background, some of the issues that I've dealt with, quality control issues that I've dealt with, have been basically in the areas that I've worked in delivery of clinical services and in laboratory. But now in the study, they are quite varied areas that we have to be concerned ourselves with respect to quality control and assurance, data processing, data flow, laboratory, the field, training. Those are issues, sections that are all under me that I have to coordinate, and I must necessarily have interest and also help in directing the development of a quality control assurance in this area, working with together with the quality control officer. Now, the quality control officer is professionally a data his professional background is in data management. So when he talks about quality control, he's especially inclined to talk about data processing, which I'm by and large quite ignorant. So what the information, the skills and the knowledge base that have been provided here, I believe is going to be of help to me guide the quality assurance and quality control planning system, which will underlie the whole field project, I believe here. So this has been quite an opportunity, and I'm very grateful.